Hey guys, Dr. Cody here, back again with another explainer video, and this time we're going over the feet. That's right, we talked about it last time, something that's going to help calm those barking dogs. And yes, we were talking about your feet. Specifically today, we're going over plantar fasciitis. Okay, so what is plantar fasciitis? Well, let's break it down. Plantar means the bottom of the foot or the plantar surface. Fascia is this dense, thick connective tissue that surrounds our muscles, and itis is inflammation. So it's inflammation of the fascia on the plantar surface. Now, most people have heard of this before, know what it is, right? Extreme sharp pain in the bottom of the foot, the heel into the inside part of your arch, okay? And it can be quite debilitating, right? And usually it's worse in the morning, right? So that first time you wake up, figure we're sleeping, we're laying down, all those muscles are hardening and kind of stiffening in place. The feet kind of lock up. You go to get up, you step out on the hard surface, it starts to stretch and spread. Ouch, right? Really, really bad pain. And this can last for a long time. Sometimes it resolves on its own, but in our experience, what we see here is that this can actually linger and last for months to years. So what causes it? That's what we're going to go over today. What causes plantar fasciitis? And just like anything, there's not one true cause of plantar fasciitis. There are different things that can cause it, but in my opinion, in my experience that I've seen here, it is kind of a combination of these things that actually leads to this condition that we see. So again, it's inflammation of this plantar fascia. So we have a ton of muscles that are running down the bottom of our foot, and really important, right? We are bipedal, or we walk on 2 feet. So it's important that we have strong arches, strong muscles in our feet. So when these muscles get overworked, get overtaxed, when this fascia gets overstretched and tugged and pulled on, it can get damaged and inflamed. And in severe cases, even where it connects to the heel bone here or the calcaneus, this part here can actually start to calcify or ossify in there, causing a spur, right? So heel spur, you may have heard that term before. Okay, so let's go over some different causes of plantar fasciitis first. Well, the most common one that we kind of see here is going to be weak muscles in the feet, or we're going to go with over tight stretched calf muscles and tight Achilles tendon. So let's go with the muscles here on the bottom of the foot here. When these muscles are weak, what can happen is that we can lose our arch. And if we lose our arch, we get these flat feet. Now, some people are born with just naturally flat feet. There's not much we really can do with that besides trying to put some arch supports in there to help support that. But people with naturally flat feet, as you walk on hard surface over time, it's going to stress and strain the bottom of the foot, leading to this inflammation. But if our muscles here are weak, most of us wear pretty poor shoes, right? We don't really wear shoes that are meant feet walking around all day. And so these muscles take attacks on the foot, and that can lead to this collapsing of the arch, which then can lead to more inflammation in the tendon. If we look at the calf here, this is probably the number one reason that I see plantar fasciitis here in this clinic is tight calves and Achilles tendon. The calf obviously is the muscle in the back of the lower leg, and this Achilles tendon, everyone knows that one, right? That's one that connects the calf to the heel bone itself. And if we look at the proximity between the plantar fascia, where these muscles originate, and the Achilles tendon, they share a very common spot here on the heel bone. Now, the calf aids in propulsion, right? So it does plantar flexion, right? So pushing us off the ground. And if this calf muscle gets too tight, this Achilles gets too tight, it can pull and tug at that heel bone. Now, when we go through our gait, we have a couple different stages of it. We have our heel strike into toe off, right? And when these calf muscles are tight, it restricts our transition from that heel strike into toe off, limiting the amount of movement we have in these muscles and the bones in the foot. And so it causes this tendon, this fascia to actually tighten up, restrict, and create inflammation, okay? Another cause that I see here in the clinic is actually going to be weak muscles in the upper outer portion of our glutes, specifically the glute medius, or our friend we talked about last time, this piriformis right here, right? So this little diagram showcasing the back of the pelvis here. So this patient would be facing away from us. We can see the surface level here. We have our gluteus maximus. That's the big glute muscle that we all know and love. And then below that, if we cut away, we can have this other muscle here called the gluteus medius. And then again, our friend, the piriformis. Both of these muscles aid in abduction and in stabilization of the hip. And something that we see is that when we get weak glute med muscles, we get a little bit of this hip drop in here. Okay, we call this a Trendelenburg sign, and when we're walking, we can call it a Trendelenburg gait, right? This hip swaying motion. And what this does is because this joint, this chain, we call it a connect chain from the hip to the knee down to the foot is one line, you cannot move this hip bone without moving your foot, right? So if you look at me right here, no matter how little I move my hip, I cannot not move my foot, right? My foot moves with it. And so what we get is when we get this excessive, we get weakness in these upper outer glute muscles, right? we get a little bit of this inward bow of our hip. And if you look down, my knee has inward pressure on it and my arch has collapsed. Now, just standing here isn't really going to do much, but take this over time, right? How many steps are we walking a day? People who are out running, playing sports, a lot of high impact activity. Over time, this constant pushing inward, inward, inward is going to wear and inflame these tendons here on the bottom of the foot. So plantar fasciitis, right? Hopefully now you kind of know more about it, what it is, what causes it. The next video we're going to go over is going to be how we treat this, right? So what do we do in the clinic here to help, and some things that you can do at home to help yourself and prevent this from ever happening as well. So hope you guys are having a great day. Look forward to seeing you in the office here. As always, see you soon.